the simple things in life
every day for 27 years.
are sometimes what you remember the most.
We would at night, good night, babe. Love you. Love you too. Sleep well.
What you miss the most.
And every morning, and I'm not kidding you, every morning, good morning, he used to come down, make coffee, bring it upstairs.
Chai Suthammanont was a beloved husband and father.
You just miss that love and warmth.
The 68-year-old contracted COVID-19 in late April.
He was intubated and he stayed on a ventilator for 21 days.
Chai died on May 26th. His wife, Christina, believes his story has bigger implications for the federal workforce. Chai worked in the kitchen at one of 2 daycare centers on Quantico. When the pandemic took hold, the centers only accepted the children of essential workers. Since those numbers were small, they combined the 2 centers into 1. While caregivers were on a rotation, here's the schedule from that time, showing all 6 kitchen workers, including Chai, were on shift together.
It would be difficult for even 3 people to socially distance. We're not talking like a huge industrial-sized kitchen. It's really basically a small kitchen.
Christina says Chai was perfectly healthy, but wore his mask and was worried about the conditions.
He would regularly say that, people don't wear the masks all the time. It's hot. There's too many people in the kitchen.
She also recalls her husband's anxiety about a colleague coughing and still coming into work with them.
When you walked in each day, you were supposed to be asked a list of questions. As soon as the person said, I have a cough, they should have said, well, then you can't come in here. I mean, what's the point of asking the questions if you're not going to enforce them for their intended purpose? That doesn't make any sense to me.
On April 27th, Chai worked his full shift at the daycare kitchen. Just about a half hour after he got home from work, Christina says he got this text message and letter from the center director. It says he was to quarantine for 14 days because an employee there tested positive for COVID-19.
Chai, on Tuesday the 28th, that's when he developed his fever. And it wasn't like a 101 degree fever. It was 105.9. He was burning up. He was like on fire.
When he got really bad, she took him to the hospital. What would be their last kiss was through masks. Chai would never come home.
It's devastating. It's a devastating disease.
Records obtained by WUSA 9 show workers' comp is covering the medical bills. But as Christina thinks more about the circumstances at Quantico before Chai's death, she believes this.
It was entirely preventable.
We reached out to Quantico for more information about what happened. We sent them this list of questions, but they couldn't confirm even basic facts for us. A spokesperson tells me she consulted with their legal team and is unable to respond due to a pending investigation. She assures me they are taking this seriously. As the country continues to reopen, though, Christina doesn't want other families to be in this position. She feels changes are needed and a new hotline should be created. That way people can anonymously voice their concerns about workplace conditions during the pandemic.
Somebody would have been able to raise a red flag.
Having a COVID-19 hotline, I think during the pandemic makes a lot of sense. It would be an extra layer of protection.
Congressman Jerry Connolly's district includes many Quantico workers.
I want to remember my constituent, Chai.
We spoke with him after a recent hearing on protecting federal employees.
Victims are not just numbers. They're real people with real histories and real families.
Do you think the federal government is doing enough to protect workers like Chai?
No, absolutely not. The more we kind of learned about the circumstances of Chai's death at Quantico, the more troubled we were by the lack of preparedness, by the lack of available protection, about the lack of very clear guidance.
So the congressman proposed the Suthammanont Remembrance Act. It would require every federal agency, including the Department of Defense, to develop a plan with detailed directions on how the full workforce can return. The guidance needs to include details like what personal protection the agencies will provide, cleaning protocols, and plans for employees who are high risk.
If we're going to be re-entering the workforce at a much higher level of participation, those people have to be safe.
From their home in Fairfax, Christina remembers her husband of 24 years as someone who always tried to do the right thing and would be all for a bill she says that would do just that.
It's too late for Chai. It just is. But at least look, he's still helping people. He's still able to make the world a little better, which, the world was definitely better with him in it. So I just have to think about it that way.